it was the first year of the National Health Service, so it was a bit of a time of change, as it were, in the hospital service.
Were you aware of the impact of the National Health Service is likely to have on medicine, or did you just take it in your stride as being, just part of evolving life after the war?
A bit of both. I was very aware of the change, and I think everybody was at that time, from the old panel system, general practice, to the National Health Service. And also had its impact in hospital medicine, where, as you know, consultants in the sort of teaching hospitals were essentially made their living from private practice. And now there were salaried consultants. I still made a lot of living in private practice, man.
Yes.
By that time, the National Health Service was operating and had been for a year or two.
Indeed, yes.
Did you detect any difference in the way things operated in Edinburgh and then crossing the border to Middlesbrough?
I can't honestly say I did. I did notice big differences later on, much later on, working in Bristol Royal Infirmary, and total differences in approach to patients and patient management. I mean this in the broad brush sense, not just individual cases. For instance, sorry, I'm jumping ahead a little bit just now, but I did a locum registrar job with Leslie Duncan in diabetes in the Royal Infirmary, which I found extremely interesting and very, very educational. I thoroughly enjoyed doing that. And the emphasis there was so much on education, which I do believe to be a fundamental part of training a doctor. You are educated, and you also educate your patients. And in Edinburgh, young diabetics would be grilled. They'd be through the third degree. Know what happens if you miss your breakfast, you run to work, you've taken your usual dose of insulin, what's going to happen to you, and what are you going to do about it? And, these chaps were really sort of grilled with this, and as a consequence of this, I think managed their diabetes probably extremely well. They knew exactly how far they could do things without compromising their blood sugar in a major extent. Getting to Bristol, I found I got my knuckles wrapped by my consultant there, because there were so many return patients to the outpatient diabetic clinic. And I said to Mrs. So-and-so, now look, we don't need to see you for 6 months. Oh, no, she said, I come back every month to see the consultant. I said, why? I don't know. So I said, well, let's talk a little bit about your diabetes and how you'd manage it. Oh, nobody has ever taught me that before. I just stick to the exact dosage of insulin I'm given. I wouldn't dream of changing it. I wouldn't dream of altering it. Are you supposed to do that? And I thought this was a terribly interesting difference in approach between Edinburgh being sort of didactic teaching, having a didactic teaching emphasis, as compared with the rather more sort of laissez-faire attitude in the south, where the patient was not given responsibility, and this all came from the medical authorities with a capital A.
The 2 years you did in practice must have stood you in good stead.
Yes, it did.
For the rest of your life, isn't it? I mean, that was great.
I think, it's a cliche to say that everybody should do general practice, but it's certainly, nothing but good can come of that. And it means you understand when a GP gets stroppy about something, you can understand, well, I would feel the same way, because I have felt the same way.
Well, it makes you realise what it's like to be slightly lonely, doesn't it?
Yes, yeah.
Yes.
That was, I found that difficult. And of course we were leading up to the National Health Service, you see, and the great fashion, or the great kind of idea about it was that they must stop this National Health Service, we can't have this. And I remember attending a BMA meeting in Walsall, and they were all grinding on about they must prevent this happening. And I was stupid or naive enough as to get up and say, what will happen to assistants? And there was a sort of shocked silence, and the chairman more or less said, "We don't allow assistants to speak at these meetings." He didn't actually say that, but he didn't need to say it because it was quite plain that that's what he meant. And then the health service started when I was at Haymar's, where I was for a couple of years, I think.
How was that? How did you feel when that happened? Did it have any immediate impact? Or?
Well, we got a lot more money.
Right.
Yeah. Your income went up from 250 to 750 or something.
Right. So that would raise your level of commitment or enthusiasm?
Yes. Yeah.
Yes. And did it make any difference to practice? Did you feel different?
No. Well, nothing had changed, you see. It was the same, we were the same chiefs and the same nurses. The only difference was a kind of bureaucratic one. And I mean, at that level, as a fairly junior registrar, you weren't involved in management to any extent.
No.